So for this question, you have a baby girl who is delivered at term after an uncomplicated pregnancy. Her APGAR scores are excellent and she appears well formed with appropriate weight and length for gestational age. Shortly after birth, screening tests reveal a metabolic defect that, without intervention, would lead to progressive neurologic delay, small head size, excessive motor activity, seizures, and a characteristic musty odor. The clinical team advises the parents that the infant must follow a strict dietary plan to avoid buildup of toxic metabolites. To ensure she can still synthesize catecholamines, which dietary component must her feeding regimen include? All right, so this is kind of a gimme, right? You've seen the musty odor, right? And that is characteristic of PKU, so phenylketonuria. Okay, so PKU. That's what's wrong with the patient, right? Now you can also see other symptoms or manifestations of PKU, including seizures. That's a big one. And then, in addition to that, intellectual disability or mental disorder, stuff like that. Okay, so in order to synthesize catecholamines, what do you need? By the way, the answer for this is tyrosine. So I'm going to cover more than I usually do for questions because the pathway here is a bit high yield. All right. So if you remember from biochem, you go from phenylalanine, right, to tyrosine. Okay. Now remember that the enzyme involved here is phenylalanine hydroxylase. So phenylalanine hydroxylase. Now, this is the enzyme that PKU, or the enzyme that's defective in PKU, right? So it's defective here. Now, further down the pathway, you go from tyrosine to L-DOPA, right? To L-DOPA. Okay, and the enzyme involved in this is tyrosine hydroxylase. So tyrosine hydroxylase. Okay, and then from L-DOPA, you go to dopamine. Right, and this might have different names, the enzyme, right? But you can just say dopa decarboxylase. So dopa decarboxylase. Okay, from dopamine you go to norepinephrine. So norepinephrine. Okay, the enzyme here will be dopamine beta hydroxylase, right? So also high yield, so dopamine beta hydroxylase. And then from norepinephrine, you get to go to epinephrine. Right? And this is today is kind of a long name, right? So phenylethanolamine and methyltransferase. Let's write that out. So phenylethanolamine and methyltransferase. Okay, so that's the pathway. So if you can, please learn this, particularly for step 1. It's super high yield. And actually, in some cases you can see, or regularly, there's a different pathway that goes from dopa to melanin. So in the question, they can also include that the patient is a bit lighter colored in terms of skin color. All right, so that's it for the SOS PKU, right? And you would definitely need tyrosine. And for these patients, you need to limit how much protein, in general, it's against like meat and stuff like that, because it also includes phenylalanine. So you're reducing the amount of phenylalanine that they're getting, but then supplementing that with tyrosine so they can develop all the other stuff from dopa to dopamine, norepinephrine to epinephrine. Okay, and then for the other options that are clearly wrong, the methoxytyramine, that's kind of a metabolite of dopamine, right? So it's not super important here. For histidine, that is an amino acid on its own, but it's useful in creating histamine. Remember the cytokine that's super important when you're talking about the type 1 hypersensitivity reactions. Okay, serotonin, this is a neurotransmitter, right? But it's made from tryptophan. So that's another high yield thing you need to know. So serotonin can be gotten from tryptophan. Okay, glutamine, it's important metabolically, but it's unrelated to catecholamine production. All right, and then L-DOPA is again further down the line, but you also really need tyrosine. Okay, so I don't really give dopamine supplements to newborn kids. Okay, so that's it for this. See you in the next one.